Catholic Health, delivering on a promise to help patients achieve their highest level of health and well-being for more than 160 years. Every day, our 8,000 dedicated professionals offer the highest quality health care to Western New Yorkers at more than 40 locations across the region. And Catholic Health is a great place to work. Our associates receive a very competitive compensation package and a large array of additional benefits that may surprise you. So what does a career with Catholic Health really mean to you and to your future? Let's hear from some of our associates who may offer you some insights.
I came to work for Catholic Health from my last organization for several reasons. First, I wanted to return to Buffalo. My last position was out of state. It was for a large multi-state, multi-site healthcare organization, and there wasn't that mission-driven, patient-focused sense that I feel that Catholic Health delivers at the bedside. I wanted to return to Buffalo, and specifically I wanted to obtain a position within Catholic Health, and I was lucky enough to do that.
I was born and raised in Ontario, Canada. I travel across the Canadian-US bridge every day to get to work. I was working in another facility here in the U.S., and a friend of mine had told me about an opportunity at the Catholic Health System. So I took a chance and I applied for the position, and to my surprise, I got it. Just over a year later, I heard about an opportunity again in the Catholic Health System for another position. I decided to apply with some apprehension, but I did, and I got the position. It doesn't just stop there, though. It also helps in the advancement of my career when it comes to tuition reimbursement and continuing my education. I'm so thankful and I'm so proud to be part of the Catholic Health System.
In my role as the RN mentor preceptor coordinator, I actually have the opportunity to work with the nurses who are preceptors, who bring in new nurses into the organization. So what I do, I offer some workshop classes to them to give them some strategies on how to appropriately train these people and get them up and running and being successful. On the other end, I also work as a mentor coordinator, and that gives me the opportunity to work with some of the new hires. The people who are coming in, especially the graduate nurses who have no experience, I have the opportunity to work with them and kind of coach them and get them successful in their role in their new role as nurses here at Catholic Health. So my role incorporates so much. I do a lot of teaching, I do a lot of program planning, I do celebrations and recognitions from the nurses. So there's a lot that's entailed in my position as the RN mentor preceptor coordinator.
Catholic Health offers me a balanced lifestyle and a family atmosphere in several ways. The most important thing is that they recognize you have your job at the hospital and your profession, but you also have a life after the clock stops, and that when you go home you have to have a full availability to your family as well, and you're giving 100% at work and 100% at home. Catholic Health includes your family in several ways. There are activities during the course of the year, for example, a family picnic or the staff and associate picnic in the summertime. There are baseball games, we have tickets to Bison's events. Catholic Health is very flexible with family hours as well. When you have a need to take care of your family member, that is just as important as taking care of one of our patients. So the balanced lifestyle that they offer for us is one of the main reasons I wanted to work at Catholic Health.
Working at Catholic Health for the past 8 years has been a total blessing to me. The flexible work scheduling that Mercy Hospital offers me is just, it's unbelievable. It's really great because having to balance my work and school schedules is very easy because I work on a per diem flex basis. So that means if I have a big test coming up or I have a clinical, they're okay with that, and they let me work my schedule around what I'm allowed to do for school. The other thing that's really great about Mercy Hospital is just the atmosphere. The employees are just great, the nurses and the physicians. It's really obvious that everybody cares about what they do there, and it's not just about making a paycheck so they can pay their bills. They really care about and empathize with the patients.
Catholic Health is very invested in educating its associates. From the nursing standpoint in particular, Catholic Health University is very available to our associates for ongoing education related to bedside care of the patient, new theories and practice for nursing, as well as making sure that our seasoned nurses are taken care of as well, keeping them in the technology loop. offering them classes for the use of the computers for electronic charting, etc. Once we are done with nursing school and we begin our practice, education has to be continual, and Catholic Health offers that through Catholic Health University, both online and in one-to-one classes, a staff development nurse available on the units to be right at the bedside and assist a new graduate in a procedure, as well as ongoing classes through the course of the year to ensure that we maintain our competencies.
Right now I'm a junior in nursing school, and I'm also an immediate treatment assistant at Mercy Hospital Buffalo. My job duties are pretty much similar to a nurse's aide. I do vital signs on the patients, EKGs, glucometers, blood pressures, and I also do all the unit clerk duties as well. The ITA program is very unique because it's designed for nursing students, and it really ties together what you do in the classroom with clinical situations that you encounter in the hospital. And the ITA program is great because it definitely gives you a jump in terms of your skills and your abilities compared to other students who don't have that fortunate opportunity.
I see myself working for Catholic Health for many, many years to come. I'm very dedicated when considering what organization that I may be working for, and Catholic Health makes me want to be dedicated to this organization. They've always supported me in anything that I wanted to do. Although I might not be in this position forever, I think that Catholic Health will really foster me in whatever direction that I choose to go into. And I'm excited. I'm excited to see where it takes me and where I end up in healthcare with Catholic Health.
I've been a nurse for about 14 years. I've done a little bit of nursing home work, and the last bit of work I did before coming to McCully was I worked in a ER in the area's trauma center. And I needed to make a switch regarding changes in my family life, and McCully Seton Home Care has actually allowed me to be more of a parent toward my kids and giving me some flexibility in my scheduling so that I can still meet my work needs and my personal family needs. Being a nurse, you're always looking for that connection with your patients, and in a ER setting sometimes you lose a little bit of that. You try to because you only get a short period of time with your patients, and you still want that. But being in a home care setting has really allowed me to sit down and basically have a cup of coffee with somebody and review what they need, not just at that moment, but whether it's just a medication question or sometimes even personal things that impact the way they care for themselves. So you really get to develop a relationship and bond with that patient in their whole atmosphere, just not that short, brief meeting you may get to see them in a hospital setting. In home care, we don't always get the fancy tools that one would receive in a hospital. And we need to mind that these people are allowing us into their homes, so we need to bring what is going to help take care of them and meet their needs. In our home care setting, we actually get a lot of different tools that we need to maintain, whether it's a congestive heart failure patient, and we can bring telemonitoring in and monitor their vitals and weight on a daily basis. It allows us to have that ongoing monitoring and let them feel safe and secure that someone back at the office is checking up on them even though we're not physically in the house. And then whatever the patient's needs are, Catholic Health has always been receptive to meeting those needs of the patient, whether it's providing glucose monitoring or just providing a charity care type care. We want to make sure that the patients are going to maintain their health and hopefully prolong their stay at home and stay out of that hospital. Being at Catholic Health has offered me a variety of opportunities within my career. Even though I am still doing the same job I applied for 3 years ago, within the organization itself, there's always room for growth and movement. The whole Catholic Health System organization is available for your room to move. So if I really wanted to, I could get back into an ER setting or go into a floor setting, or what other opportunities there would be afforded to me. In addition, management is always looking for people to help fill in different roles, and they've actually approached me to help fill in different areas. So they're always open to your ideas and comments, and there's always room for you to grow and move forward. So you never feel too stagnant in one position, and you can move on and still have that, be a part of a good organization.
Catholic Health. See us in a new light.